I'm a master's student here, and Hemajith is a student from the University of Ruhuna in Sri Lanka. And we did a partner project with DGHI on the psychosocial and musculoskeletal problems faced by Sri Lankan rubber tappers. So we're going to talk a little bit about the research collaboration today and the results of our research and some things that we learned while we were on the ground. So this is just an overview of what we'll be talking about, some background on Sri Lanka and tapping, our research, some of the barriers that we found to the success of rubber tappers, some solutions that we've come up with, and then we'll have some time for questions and a discussion. So as I said earlier, this is part of a twinning program at DGHI, which partners Duke students with people working abroad. So I'm a Master's of Science and Global Health student at Duke, and then Hemajith is a student studying at the University of Ruhuna in Galle, Sri Lanka, which is located here. And we're both using this project and this research as the basis of our thesis projects for our master's degrees.
So I'm Hemajith, so I'm here to introduce our research. So officially Sri Lanka is a Democratic Socialist Republic of Sri Lanka. Population nearly 20 million. Population density 323 per square kilometer. Land extent 65,000 nearly. When we are comparison to North Carolina, it is my whole country is smaller than North Carolina. So official language Sinhala and Tamil, but English also using in some official works. And life expectancy for women, you can see higher than men. So ethnically majority are containing Sinhalese and Sri Lankan Tamil 11.2, and more means Muslims 9.2, and Indian Tamil. Just we are talking about this plantation sector. These are the people we have to especially stress and talk on our research. So religiously Buddhists are majority, then Hindus and Muslims and Christians. So what's this? So historically Sri Lanka, Sri Lankan rubber plantation, actually rubber is not native plant. In 1876 British started to plant rubber in Sri Lanka. After that in 1990s land extended was 600 days. Then 1920 you can see rapidly grown more than 18,000 hectares. So after that we got independence from British, because since 1815 to 1948 we are under the control of British. So we are getting dominion freedom in 1948. Then after that 1972 we became a republic, then under the Sirimao Bandaranayaka government. Then that Sirimao Bandaranayaka made a rule, that was a Land Reform Act. That is very important for the plantation sector, because from this Land Reform Act, government limited private ownership up to this 50 acres. Then 1975 that same government introduced nationalization of private-owned estates and other companies. Because up to 1948, British ruled our country. Then up to 1972, they had indirect control. Then 1975, Sirma Bandaranaike, what they have done, they nationalized all those companies belongs to foreign that companies. So after that, 1977, we are having new government, and under the president of Jayawardena, what he has done, he opened the economy. Because of open economy, the private sector became very popular in Sri Lanka. After that, 90s government, what they have done to find government revenues, so they privatize almost all government properties, especially land. So this is the history that important to see our research on plantation sector, especially in rubber.
So you guys probably don't know the process of rubber tapping. It's what leads to the tires we have on our car, the rubber gloves we use in the hospital, but no one really knows where that rubber comes from. So this is kind of a pictorial view of what happens when someone taps a rubber tree. First, they go up to the tree and take this collecting cup that has been sitting under the tree and has collected the previous latex, and they remove the clump of latex that's stuck in that cup. So that's this first picture here. And then they actually perform the cut in the tree. So they make a small incision with a tapping knife, and which allows the latex from inside of the tree to drip out of the tree into that collecting cup. At that point, they move on to the next tree, and they do this to 300 trees to 600 trees a day, depending on if they're doing one area, which is 300, or also a second area, which would equal 600. After all of the trees have sat for a few hours and all of the latex has dripped out, they go around and collect that latex in buckets, which is shown here. And then they transport that latex, usually on their head in this position, which can weigh many kilograms, up to, I think, 10 or 15 kilograms. Sometimes for as far as a kilometer, to a collecting center where they weigh the latex and then they get paid based on how much the latex weighs. So why did we choose Sri Lanka as the place to do this study? One, because of our partnership with Sri Lanka, but there's also many reasons that Sri Lankan rubber tappers should be studied. So almost 30% of the population of Sri Lanka works in agriculture, and rubber is their third largest agricultural export. So they do everything from the planting of the trees, the tapping of the trees, the processing of the rubber, and the exporting. And they employ more than 200,000 people in the rubber industry in Sri Lanka. And the amount of land under cultivation in 2014 was 287,000 acres, which probably doesn't mean much to you in that form, but one tapper can tap about 2 to 4 acres. So as many as 50,000 to 100,000 rubber tappers work in Sri Lanka. Also, the political environment surrounding rubber is very interesting in Sri Lanka at this time. In 2010, there was a huge investment in rubber. They were exporting $1.3 billion of rubber a year, and they created this rubber sector master plan, which was supposed to expand the rubber sector in the country by more than 3 times and triple this number to $4 billion in exports by 2022. So there was a huge commitment to making this industry better, and they started training more tappers and putting more people in the field. Unfortunately, the next year, rubber reached an all-time high at 600 rupees per kilogram, but since then it's been decreasing quite a bit. And there's a lot of reasons for this. One big thing is that China is stockpiling rubber right now, so they're not taking in many imports. So rubber prices have dropped since then, and the demand for rubber is down. And if you actually look for this master plan on the government's website, it's completely gone. They are not committed to it whatsoever anymore, but they've created a bunch of jobs in rubber that now are not very profitable.
So, in our research, we have lots of objectives. So, we are mentioning in here, describe the occupational environment of rubber tapping, and describe the demographic and socio-economic characteristics. Then we want to determine prevalence of musculoskeletal symptoms in rubber tappers. So then in my part, I'm trying to identify prevalence of stress and depression, and by using WHO QOL graph, I'm trying to measure quality of life of rubber tappers. So
so we're going to go through. Do you want to do this one?
okay, then in our research we have done 30 respondents, or research on 300 respondents. So in Galle district we have 3 major plantation companies. Among them we have selected 2 largest plantation companies called Watavala Plantation and Alpitia Plantation. So from each estate we got same proportion of sample. So by gender we got interview, we have done research for 117 and female 183 out of 300. So in age wise, below 35 we got 53, and age 35 to 55 we got 188 respondents. Then over 55 we got 59 respondents. Then according to educational level, we got no schooling. Actually, you have to think about as a developing country, Sri Lanka having 98% of literacy, but in here you can see no schooling 1%. So 71 respondents in that containing 23.7. Then grade 1 to grade 10 we got 205 respondents. Then 68.3 for above grade 10 we got only 24 respondents. That only 8% of the total population. So
yeah, so some things to note from this are there's a large number of females working on these plantations, up to 70%, and the population is very old for physical labor compared to what we would see in the U.S. So only 17% of people were under the age of 35, and almost 20% were above the age of 55, which is actually the retirement age in Sri Lanka. So that's something to think about while looking at our data. So my portion of the study was looking at musculoskeletal disorders and injuries. So we'll talk a little bit about the numbers for that now. So we used the Nordic Musculoskeletal Questionnaire to ask people about how much pain they have had in certain body regions in the last 12 months. And this is the results of that. So we found that 43% of people had pain in their back, shoulders almost 30%, neck 20%. And these are really high rates. I know it's hard to, without a comparison group, But if you look at this picture, this is how they transport the rubber. So this is probably one of the main reasons that they're experiencing neck and shoulder pain, which we'll get into a little more later. Additionally, we looked at injuries on plantations, which we found very high numbers. Remember, this is out of 300 respondents in the last 12 months. So out of 300 respondents, there were 182 knife cuts in the last 12 months, 176 issues of skin irritation, which is when they get rubber on their skin and it gets really itchy. There were eye injuries, 26 snake bites, so almost 10% of the population had been bitten by a snake in the last 12 months, and 103 falls. And then I think this table actually tells you even more about this. So this is how many days of work they missed because of these injuries. So knife cuts and falls made them miss a lot of work, but if you compare the size of the lines for snake bites on the two graphs, you can see that each snake bite makes them miss about a whole week of work. So as I said earlier, the tappers are paid on the amount of latex they collect, so every day of work they miss exacerbates that cycle of poverty that they're in. Then Hemajith will talk a little bit about his results.
In this research, my proportion was psychosocial, to understand psychosocial issues. So I used for this research perceived stress scale, that is standardized scale to check stress. So see what I found from out of 300. 44.7% was average. But see, high stress and very high stress, how much they have in the among respondents? Nearly 55.3. So we have identified this research level through our research analysis. Then I'm going to say about Peradeniya depression scale. This is the scale introduced by Peradeniya University. This is actually designed for South Asian countries. So from this scale we found 9% depression. So this is actually little bit high among the population. So this result results is indicating the psychological condition of the respondents.
So both of our thesis projects will focus on a more quantitative analysis of the risk factors that we find are correlated with that data using a regressional analysis. But since we're both going to give presentations on that in the near future, we thought we would talk more about some of the things that we saw on the ground that won't necessarily come out in the numbers. So things that we learned from talking to people, plantation managers, people who worked on the plantation and managed the actual rubber tappers, so the field workers, as well as talking to the rubber tappers themselves. That paints more of an environmental picture of what's causing these barriers to health and well-being. So first I want to talk about some physical factors. By far the biggest thing preventing rubber tappers from making a living wage is rain. Rubber tappers cannot tap trees when it's raining because if the water mixes with the latex becomes completely unusable. So every day that it rains in Sri Lanka, a rubber tapper does not get paid, which is usually a pretty consistent 4-month period. But in the past few years, the rainy season has been varying quite a bit, and rubber tappers aren't able to determine what time of year they won't make this money. And actually, the for the entire time that I was there for 3 months, they only tapped like 4 or 5 days, I think. And that is not traditionally the rainy season. So seasonal poverty because of rain is a very huge issue for tappers. Pain is another physical factor affecting their livelihood. So as I said, there's a very high number of musculoskeletal problems in the population. There's never been an ergonomic analysis until our study on the method of rubber tapping. And as you can see in this picture, it's a lot of bending and repetitive motion. So when they make the cut, they have to repeatedly move their arm back and forth and keep their upper arm and shoulder in flexion, which can cause musculoskeletal problems. And this method was actually developed around the time that rubber was brought to Sri Lanka, so back in the late 1800s. So there's never been anyone who's looked at making this method better for workers. Another issue is lack of personal protective equipment. You can't really see in this picture, but one of the pictures of a rubber tapper is actually right outside the door printed in DGHI, and in that picture you can see that he's not wearing any boots, any gloves, any eye protection. These are all things that would prevent those injuries that we talked about before, and none of that is provided by the plantation or required by any kind of occupational oversight board. Lastly, in the physical factors, there's no workers' compensation for the injuries that do happen. This is a huge issue because we found that in only 300 tappers, they had missed over 1,000 days of work in the last year because of injuries, and none of them are getting compensated for that. There are also social factors that affect the well-being of rubber tappers. The first is education. As we saw, the education level of tappers is much lower than the rest of Sri Lanka. And this doesn't only affect how educated they can speak, but also they can't fill out forms to apply for loans, they can't fill out forms to apply for a bank account, they can't read signs that are posted on the plantation about seminars they can attend or further education that they can learn about. So education is a huge factor. Additionally, they lack occupational diversity. So as I said, rubber tappers can tap when it rains, but there are other sources of income that they could partake in during those days. One example is tea plucking, but many of the rubber tappers we talk to don't feel that they are qualified for those jobs. So some kind of program to help teach rubber tappers about the other kinds of income generating jobs that they can do on the plantation or even off plantation would be a great way to supplement their income during the rainy season. Lastly, social image is a huge thing for rubber tappers, so they really aren't proud of their profession. There's other professions on the plantation. One example is oil palm harvesting. So there's huge trees that produce these seeds that have oil palm in them, and they collect those seeds for harvesting and make it into oil. And those workers have uniforms, they have boots, they have hard hats that are provided to them, and they're very proud of their jobs. But rubber tappers aren't provided with any of this, and they have a very negative perception of their work and don't want to tell other people because it's not thought of as a good job. Additionally, they all work and live on these plantations. So one of the things we talked to many of the managers about was trying to call them villages instead of plantations, because they really are their homes, and not being able to associate that with a community, rather thinking of it as a workplace, is hurting the social image of the workers. Furthermore, there are a lot of economic factors that affect rubber tappers. First is the government grants. There are a lot of grants available to tappers, but they don't know about them. We asked in our survey about who had gotten grants, and less than 10% of workers had actually received grants, but all of them, based on their income level, were eligible. Another is the ability to save and borrow money. So they don't have the bank accounts, like I said, and they don't have access to formal loans. So many tappers will take out informal loans on the plantation in these kind of like black market loan situations where they have much higher interest rates than a formal loan from an actual bank. Lastly, in the economic factors is the willingness to save. So many tappers, so as I said, tappers have this period where they make a lot of money during the dry season, and then rainy season where they experience seasonal poverty. But during the dry season, many of them will buy expensive things like gold and televisions. And then when the dry season or the wet season comes and they're not able to afford food for their family, they have to sell these things at a loss. So any kind of educational program trying to encourage people to save would help prevent that seasonal poverty. And lastly is some political factors. So as I said in the beginning, the prices of rubber are greatly declining. So Sri Lanka isn't exporting as much rubber. Other rubber producing countries have put in place price support measures. So they have started to use this rubber to rubberize their roads, or they're actually buying the rubber off of the plantations and stockpiling it so that these people can stay in business. Sri Lanka is not doing any of these price support measures, so there's a lot less incentive for plantation managers to keep planting rubber and to keep paying their workers a living wage. Additionally, and lastly, there's advocacy and community engagement. There's no open lines of communication between the workers and the management. The workers that we talked to were actually very, very excited to talk to us because no one had ever asked them about their problems before. So creating this open line of communication could do a lot to help other tappers. So now I'm just going to talk about some of the solutions and some of the things that we're trying to do to address these problems.
Okay. When we were doing our research, we found lots of injuries. For that, we have already introduced first aid programs. So we already, before Kayla leaving, we have done 2 first aid programs. So from those first aid programs, we are teaching them how to deal with injuries and especially CPR and special like snake bites and other cases and like that. So next one. Of course, most of rubber tappers, they are not educated as you see. Their literacy level very low, so they don't know how to manage money. So just think, if they need 5,000 rupees per month, they have, if they are getting loan from illegal way, they have to pay 20% of interest per month. So calculate how much they are losing their money by taking loans. So for that one plantation called LPTA plantation, general manager introduced a system for his estate. Almost all workers, they have introduced bank ATM card. So, but in our observation, the other plantations, that is actually good system, because we inquired that manager and what is the progress of that program. He is saying even now even workers saving some money, not without losing money. So we can introduce this program for other estates. So, do you want to say something?
Oh yeah. So also, one part of this program was that the bank will automatically track what you spend your money on. So they're able to look at these reports that show them just how much money they're wasting on alcohol, beetle chewing, which is a kind of chew that they have there, and other substance abuse, and see how much more they could, how much of their livelihood they could save if they didn't participate in those things.
So especially the beetle chewing, almost all workers chewing beetles, then they are still we did not analyze those, no? So then for our tapping, we identified that when they are tapping rubber, the tapper should have proper eyesight, because that is the we have a knife.
Oh yeah, you can.
So if when they are dealing with knife, they should have proper eyesight, because if they are not cutting that bark properly, in one side it's harming for tree, in other side the tappers getting self injuries. So from our research we have identified that most of tappers having eye problems. So for that we introduced eye screening program. Already we have programmed one, but after I'm going Sri Lanka, I will continue that program because actually in Sri Lanka we don't have much more funds and facilities, but in my faculty, that medical faculty, we have one professor specialist in eye. So that eye surgeon, we are going and talking with plantation managers, and those we have ran one program that was I contact one plantation manager, and he sent us 20 volunteers, and we trained those 20 volunteers to identify eye problems. Then we deployed those 20 eye volunteers in that particular estate, and we found 150, more than 150 workers with eye problems. Then what we have done, we invited them to come Faculty of Medicine, Karapitiya. Then we treated those more than 150 patients. Like that type of programs we can do within Galle district, but we cannot go outside Galle.
Right, so
then actually they didn't have money to make their spectacles, pair of spectacles, and to take medicine. So I found one NGO called So Others May See. Then I contact with them, and for 40 patients we made spectacles by funding this So Others May See organization. So in occupational safety, you can see this. This is actually rubber land, but you can see bush and vines, and you can see even proper path. So in this type of, more than this type of worse situation having inside the land, so land managers should give attention to clean those rubber lands, because without landscaping people cannot get proper security, especially for snake bites, falls in the lands, and other injuries. Especially we found one pregnant woman, she got abortion when she was walking in the field. She fallen down. So then land managers should give attention to introduce personal protective equipments. As you see in early photographs, they are not using anything, only this knife using for tapping. Even eyes protection or boots or hand gloves, nothing. So since hundreds of years, how they tap rubber, like same they are tapping. No intervention, but they have some people had interventions, but by introducing new knives and other equipments, but most of managers not using those things. So injury and lost time tracking. So
Yeah, so they also don't track any of those hundreds of injuries that we found over the last 12 months. So any kind of tracking system to start tracking where these injuries are happening and follow up on them to see, really look at the root cause and try to prevent them. Because preventing these injuries is not only a financial incentive for the workers, but also the plantation managers. Because when their tappers aren't tapping, those trees aren't getting tapped and they're not making any income from that whole section of the forest. So there's a very big incentive to start preventing those injuries. So lastly, there's a few other things that we would love to do from this study. So like I said, I think that the biggest barrier overall to rubber tappers making money is that they cannot tap in the rain. So some people have created these rain barriers which just cover the part of the tree that's being tapped and allow tappers to still work when it's raining. But people have very negative perceptions of them. Some tappers say they don't work, they say they fall off. So doing this study and looking at what are the positives and negatives to them, how long do they work, how cost effective are they, would be a really good first step in trying to get the uptake of these kind of innovations more widely used. Additionally, as I said, the knife has been the exact same for over 100 years. And here is an example of a tapping knife that I brought back from Sri Lanka. This part in the front is sharpened, and they use this handle that is very not ergonomic to just shave away a little part of the tree like this. And they usually put their thumb right here to balance it against the tree, and when they hit a knot, it slips, and that's when they cut themselves. So there's a lot of ways we could redesign this. I'm an engineer, so this is really my cup of tea, and I really, so I'm working on redesigning the tapping knife, and you guys can take a look at it if you want. Additionally, there could be a lot of further studies done on other plantation workers in Sri Lanka. Like I briefly mentioned earlier, there's a there's a crop on plantation called oil palm, and these workers actually use huge poles that are I don't know how long are the poles. They're very long poles, like longer than this entire room, to reach the top of a palm tree and cut off a bunch of oil palm bunches that are at the top of the tree. So they have to keep their arms above their head and move this very large knife back and forth to chop off this bunch of palm oil. So there's a lot of, maximum of 50 feet. So they're very long. And so there's a lot of potential for musculoskeletal disorders in this population as well. So I think we could do a similar study on that population, or also cinnamon peelers on plantations, which is also a very intensive job. So that's all we have for you today. Do you guys have any questions or? Sure.
There was a kind of like a little bit of a jump there from the background about Sri Lanka, and then you came to the results. If you could say a little more about kind of what you are doing as part of your master's thesis, what concretely are you doing? And this, I think that's of interest to the master students here. What was your role? What did you do? And then also maybe what your twin did.
Sure. So as part of the twinning project, we kind of had separate parts of the study. So my part was looking at the musculoskeletal issues and the injuries on the plantation and pretty much the overall physical health of workers, while Hemajith looked at the mental health of workers. So our study design was we had a questionnaire that had questions for both portions of our study, and we interviewed 300 workers as part of that questionnaire. And then in addition to that, we did some physical observations of the workers, which is an ergonomic analysis of their working positions. So that's something that I had known how to do from my background in engineering. And I went out and we followed 90 rubber tappers for a number of trees for each tapper to see what kind of working positions they work in, how repetitive the work is, and how much they bend. Things like that, or some ergonomic risk factors, and that will also be part of my personal analysis.
But something about language maybe, because that was an issue that kind of made the twinning idea a very good one.
Yeah, so the twinning, there were a lot of very positive things that came out of the twinning portion of the project. So Hemajith was able to do a lot of the translations for me, work on coordinating everything in country, while I have more of an analytical background, so I was able to do a lot of the analysis as well as design the survey and things like that. So it was very advantageous for us to be working together in this project.
For me, it was pretty nice experience because we both have done in same community and by using one single questionnaire with corrective way. So in Galle district, we have ran nearly 2,800 kilometers to collect those data around Galle. That was actually a huge task for us because in those days we went those research sites, but we didn't get respondents because of rain and so many reasons were there. So anyhow, we have done our best, especially we made lots of contacts, especially Kayla and myself, and we got lots of opportunities through this research. So if you need more information about what we have told about that rain cover and why they are not using or something, you can explain a little bit about that, no?
You may want to say how you were traveling around. That was actually a little surprising to me when I heard when you came back again how you have been traveling, both how far you had been traveling, but also how you had been traveling.
Yeah, so we put over 1,000 miles on Hemajith's motorcycle on this trip because the plantations are very hard to get to. The roads aren't well upkept, and many places you couldn't physically get there in a car. So we used this motorcycle to get everywhere. Yes?
You both talked a little bit about going back to the plantation managers, and how did they receive you as a research team? Were they happy to have you talk with the workers? Were they skeptical of your project? What's the incentive for them to improve working conditions? And I guess the follow-up would be, how did they get paid? If the workers are being paid by the kilogram, what percentage are the plantation owners or managers taking? of that that would make it worth their while to improve working conditions so that they'll get more?
Sure, so I can talk to the first part of that question. The plantation managers were very excited to work with us, which I thought was pretty interesting because we were uncovering a lot of problems with their plantations. But from my perspective, I saw that they really see their plantations as a community, and they want to foster this village image of where they're living and where they're working. The managers are also living on the plantations within a few kilometers of the workers, and they really want to improve the health and well-being of their workers, and that is reflected in the fact that they were very receptive to doing the first aid programs that we made, because they actually donated the money for our transportation to the plantations for those programs and providing food for the workers for those programs. So they were very interested in working with us.
For one rubber tapper has to tap 275 to 350 trees per day. They are doing one block, but some are doing 2 blocks. So from one block, averagely they are getting 22 liters of latex. It contains 8 kilograms. If someone taking more than 22 liters, estate paying 8 rupees for 1 over kilogram. So nearly their daily wage presently near 650.
So that's about $5.
Yeah, per day. Then
You know how the managers are paid then?
yes, for my friend assistant manager 60,000, for manager nearly more than 1 lakh.
So
With all
they
facilities.
get paid a salary. So they're salaried. It's not dependent on how much rubber they take in, but so any extra rubber that they take in, the company as a whole keeps, right? So those upper level management, and so they want to make their farms more productive because they have all of these statistics that they put out at the end of each year, and it's been their annual income has been decreasing. So to keep them as productive as they used to be, they have to make rubber more
If you
affordable.
Yeah, if we are when we are thinking about their income, monthly income average 18,000. If they are getting maximum means average maximum. So, but when we are thinking about average expenditure, how to say that monthly wage, nearly 12,500. Government calculated expenditure. For one family, that means husband, wife, and 1 child, children. Most of families having more than 2 children. But when they are having long rainy season, what is happening? Nearly 7,000, 5,000 to 7,000 they are earning per month, but their expenditure more than 15-20,000. They are having lots of problems. That's why they are. As she said, when they are having money, they are taking lots of things, television, whatever, gold, jewelry, and everything. But when they are having wet season, they are selling in cheaper price because they don't know about valuation of those goods, like that.
Any questions from the students here? Or does this kind of look like the projects that you are doing or that you'd like to do? Some of you master students here? So you are looking for projects?
The 2 back rows are my cohort.
We just got back from the field too.
Okay.
So I have a question. How did you come upon the project? I mean, was it, how did it start? How did it all start?
Yeah, so, do you want to speak to this? Okay, so, some other workers in Sri Lanka had originally identified rubber tappers as a potential project in Hemajith as well. And I did an initial literature review of these plantations and found that no one has ever done research on this before. So we thought it was a very advantageous project for us to look into. And it also fit really well with Hemajith's and my interests. So I wanted something that I could look at, like an ergonomic analysis or something to relate it back to my background in engineering. And Hemajith wanted to look at mental health problems because he has a background in psychology. So it fit really well for our what we wanted from the project.
First of all, I would like to thank Dr. Truls and Catherine because they have initial idea for that because we, professionally I am working on psychological and sociological background, but when we were talking about projects and others, so actually this twin scholarship topic, the theme became from
And I think kind of going back a little further than that is that we have had a relationship with a relatively small university in southern Sri Lanka since after the tsunami. We started then with some small research projects based on some funding that we had got from the chancellor. And then since then there has been a number of research projects going, but also a relatively large number of students, mostly master students, have been going and doing projects. And because one of our kind of most valued partners there on the faculty side is an occupational health physician, occupational health researcher, he has opened doors for us there that would be very hard for us to do otherwise. If we had just identified this as a problem and then gone there and knocked on the doors of these plantations, I don't think that would have been easy. But because we have a local person there who is very much part of the kind of occupational health scene and has a lot of practical connections, that has made this very possible. And I guess also Hemajith had also some personal connections to these plantations, so that also made it a little easier to get in than if we were just doing it ourselves from here.
Of course, because in plantation sector, because they are running for profit, definitely they are saying we have done for this, for community, this and that, but their major intention for profit. So when we are requesting, when we were requesting from plantation managers, we had to write and write and write to get permission. Then what I understood, rather than going that official channel, going through personal connections, it was the easiest way because we got lots of opportunities through that way, especially few of my friends working those plantation companies. So we got opportunity to access because we made a network by contacting agents.
Okay. I think there are two comments to that. Also, if we wanted to do something like this in North Carolina, no, of course rubber plantations are not the big thing here, but something similar, I'm pretty sure that would be nearly impossible to get in if we thought that was a problem. An employer here would not be particularly interested in some master students from here going and looking at health problems in their factories. So in some ways we were a little surprised about that. I think one risk to that is you're asking what these plantation managers thought about this. My feeling is that these plantation managers are maybe a little more positive and that these plantations here are better run than some other plantations, and where there are really some bad practices, they would not be particularly interested in it. I think that is a potential issue here, that in spite of the fact that we feel a lot of problems here, still this is probably a little bit better than some of the others that we didn't get access to.
After 1990s, lots of those plantation companies, that regional plantation companies emerged. Before that, most of workers who work in the plantation sector, they work as a slaves. No rights, even no citizenship for especially Indian Tamils. They were not. But now they are having almost all right. Then the people getting more educated, because the most of young generation getting education and others. So plantation managers have to give something for them. If not, when when the government or some institution checking their quality or standard, they are getting failed. So that's why they are more concerning about those. Not in my side, that is not proper intention to help them, because think about if plantation manager helping for their children's, what they are thinking, oh, we are losing one man, one resource person for our estate, like that way. Because they need, without education, without any skills, because they want to continue their works with workforce.
Were these workers unionized?
Yes.
Yeah, so
But
that's,
not more powerful.
well, that's actually something that the managers complained about a lot, because they would rather pay them less money now because they're selling rubber at a lesser price, but they do have a union that's supporting their wage, so they are still getting paid even if it's not a living wage because of the number of days that they're able to work.
So if you are thinking about infrastructure facilities, road condition work is too worst. Even we need pickup if you are going by 4-wheel drive. So, and especially their living condition, their homes provided by estate owners. How much more than 50%?
Yeah.
Okay, more than 50% provided by estate owners. Earlier there's that called line rooms. If you have experience and if you have seen those line rooms, I think you have seen line rooms. It is worst condition. Only one room, they are cooking and everything, sleeping and doing in the same room. Even 5 members in the family. But some projects received some plantation companies, then they have given few, nearly 50
Yeah,
or
nice.
some houses like that.
Yeah, so as you can see, there's a lot of additional things that we learned too that we couldn't fit into a 45-minute presentation. But
Okay.
very cool.
Okay. Thank you very much.